welcome back to my YouTube channel. It's been a while. You all know I'm not an influencer or content creator. This is something I do because I love, but I thought I would come here today and kind of continue some of our medical series. So welcome back. It's been an amazing journey so far. Thank you all for watching, recommending, and the encouragement to keep going. I appreciate all the support. But today I wanted to talk about chest pain. This is something that, is within our community, and people do not know what to do, especially when some of these things kind of come around. So for the sake of my Ghanaian community, I will be infusing some Ghanaian language, some Twi language into the discussion today. So the purpose of this talk is just to be able to identify what feels like an emergency, urgency, or something that, you may be able to sit around and kind of wait for a few days before you go see the doctor, see if it goes away or not. So there are different causes of chest pain, okay? And I cannot even exhaust it because it can go from anything from, top down. So I am just going to talk about a few things. I have this whole thing here, just points, things that I want to touch on briefly. So the first thing that we are going to talk about, obviously, when anybody hears about chest pain, is heart attack or chest pain that is actually coming from the heart. Or myocardial infarction is what most, healthcare providers will call it. So that is really an emergency. Obviously, if you feel like you're having a heart attack, you need to go to the hospital, right? You need to go to the emergency room, get it taken care of. But how do you know that you're getting a form of heart attack? Because there are kind of variations, How do you know that you're getting a form of myocardial infarction, which is basically loss of blood flow to your heart? Into moja enko wakuma, then that means there is an area of your heart that is not, getting enough blood to pump into wakuma na enye ejuma. And then your friend mostly myocardial infarction. But yeah, what of course heart attack, I was say immediately ejuma. And I said they will say but things are kind of progressing, and you need to still, it is an urgent situation. You need to kind of take notice of that. So one, how do you know that this is something that you need to straightly go to the hospital for? So if you have chest pain that is coming on with minimal exertion, you feel chest pain, mostly it's in the middle of your heart, we call it substernal, sometimes on the left side. Other people have it on the right side. Mostly male or females have what we call atypical kind of chest pain, where it is not a classic heart attack symptoms or signs, basically. So mostly, but we call it substernal, like the middle, behind the rib in the middle, substernal chest pain. Sometimes it can go to your shoulders, goes to your shoulders, goes to your arm. You have nausea or buffalo. Sometimes you're sweating a lot with just minimal. Sorry, kakra yesayana or or sweat it. If you're afraid to, I will buffalo, or chest pain or cold and it mostly lasts a few minutes. When you rest, it goes away, and then it kind of comes back again. Those are things that you need to kind of be very hyper aware of. Things that are, if you continue to exert yourself, it continues to get worse. You rest, it gets better, or even sometimes if you rest and it's still getting worse, then that is an emergency. You still need to go. That's an emergency, you need to go. But these are things you want to take notice of. These are like classic signs. That chest pain radiating to your shoulder, even to your back sometimes, to your back. You have nausea, you're tired, it lasts for a few minutes, it goes away, it comes back. So it doesn't last for like the whole day. If it's lasting for the whole day, you're able to do your things, it's probably not the emergent heart attack that is coming on. So that is like the one that we need to, but they're different. I'm not talking about all the types of heart attacks or myocardial infarction, because sometimes even when you're sick, even when you are in the sun or something like that, any kind of stress can cause your heart to need more oxygen that is not getting, and that is sometimes called some form of heart attack or some form of myocardial infarction. So that's not what we're talking about. But yes, it needs to, if you're having all of these class of signs, then you need to go. The next thing is aortic dissection. So you have a big blood vessel that kind of supplies a lot of your body parts that runs in the middle of your body. So that can sometimes tear, and that could cause significant chest pain, similar to, the heart attack symptoms, but mostly you have that radiating to your back, or feeling or have a still. So feel a chest pain and you cough from animal equisi actually. Or blood pressure, it was true. So blood pressure, 200 then that is something, an emergency. You need to go and see a doctor right now. Blood pressure is high, your heart rate is, low, high, you're tired, you're dizzy, all of those things, you need to go. So sometimes that could mean, aortic dissection. Again, sometimes you have blood pressure issues that is already uncontrolled, and that even blood pressure being high could cause you to have chest pain and not the other way around. So there's a lot of overlapping signs and symptoms with all of these things, but things that you need to be aware of. The other one is pulmonary embolism, just basically getting a clot into your the blood vessels in your lungs, basically, and causing significant loss of blood flow. Okay, and most people who have pulmonary embolism is because they have a clot somewhere that kind of migrated to your heart, your lungs, basically. So most people will have something we call DVT, or clot in the veins of their in the legs. So that's when mostly, because you have a vein that basically goes straight into your heart, and your heart vessels go into your lung, get oxygen, all of those things. You're not talking about anatomy, but that blood vessel, that clot travels through that vein and it ends up in your lung somewhere. Okay, and that is also very dangerous. Sometimes you have little that you could be like, okay, but if you don't take care of it, it becomes a very massive pulmonary embolism that can be very fatal. So if you're having like chest pain, shortness of breath, even sometimes significant cough, you cough up blood, that is a sign that you may have maybe something, and your heart rate being super elevated. Your heart will beat very fast into your heart rate, that is sometimes a sign of pulmonary embolism. And if you've traveled a long distance, we'll call Ghana, and that's if you're Ghana, one crowd to plane in 12 hours. You can, because you're not moving, the blood can become static, and then you can develop the clot in your legs, and your legs can be a little bit swollen. If you feel like your legs are, one leg is swollen, warm, painful, coughs, one and two, but see free plane, all of a sudden, that is an emergency. That means there's something that happened in between, the travel that could have caused that. So that's one. That's also another thing. Another form is called esophageal rupture. I don't think I've actually seen an esophageal rupture, which is your food pipe basically kind of busting. I've never seen it before, but it's basically the chest pain kind of radiating to your back. You have some acid kind of reflux into your mouth. You feel some acidic taste. You're sweaty. You may be vomiting. You may be having significant chest and belly pain. So again, these are overlapping things, but these are emergent things that you need to, don't sit around and be like, oh, it will go. But because if you have an esophageal rupture, just like a aortic dissection, it's not going to go away and come back, you know, just like sometimes the chest pain for cardiac, like glaucoma chest pain. This is something that will last for a long period. You continue to have this chest pain because it's ongoing. So that's an emergency. Another is pneumothorax. Basically, you have lines in your lungs. You know, you have a bottom one or inner and an outer, and basically air seep into that area, kind of compressing your lungs where you're not getting significant oxygen or air, you know, exchange. So that could be spontaneous. You're not doing anything, it happens because some people have underlying diseases. If you have something like COPD or, you know, something like, what do they call it? Marfan syndrome. It could sometimes happen in women. You call something like LAM. I won't say the full name because I'll butcher it. Sometimes that could, just that underlying condition could make you prone to pneumothorax. But other times, because most times when people have had trauma, that's the reason for pneumothorax. So trauma is a big thing. If you fall from a ladder, or, you know, we were already in the hospital, a lot of things that was done in the hospital may cause you to have a little bit of a pneumothorax. So that's also an emergency, because sometimes it's a gradual thing, but if you have trauma and you have a pneumothorax, you're gonna have, you know, immediate chest pain, and that is something you need to go to the hospital for immediately. Again, another form of a heart one is called pericarditis. So pericarditis is just inflammation of the outer layer of your heart. You have an outer layer, which is the pericardium of your, well, let me just put it that way before someone comes in and say, oh, the outer layer is called epicardium or whatever. Anyways, but the outer layer of your heart, you know, it just becomes inflamed. Mostly it's as a result of a viral infection. You get a respiratory infection and you end up getting inflammation with that layer. The classic chest pain sign that most people would have is chest pain that is worse when you lay down and better when you're sitting up. Into chest pain, you know, about a week ago, 2 weeks ago, when you're cold, all of a sudden, your chest pain, no da now but what's not say and answer leaning forward na better and a sign of pericarditis. Mostly it you use, you know, anti-inflammatories for this, but there are specific anti-inflammatory in doses. So I would not say it can get to a point where it may be dangerous or it may be severe, because you can get fluid, you know, in that space as well, that could lead to other things. So it may be something that you may be wishy-washy about going to the doctor for, but this is something you still need to go to the doctor for and get treatment for it. In talking about pericarditis, there's also myocarditis, which is just basically the thick muscle of your heart. The myocardium is inflamed. Different causes of that, but also the most common cause, or most people that I've seen, is because they had a virus, they were sick, and, you know, a few days later they started to have this like constant chest pain. You take Tylenol, ibuprofen, it kind of goes away and it comes back. You know, you're still either feverish or sweaty, you're not feeling well. So all of those things could be as a result of that myocarditis or pericarditis, actually. But that class is sign of you lay down, it's worse. You sit up, is better. It's mostly like pericarditis. Let me see what else I haven't mentioned. Another big thing that we mostly miss is just general like pneumonia, okay? Because you can have inflammation of the lining of your lungs. That would also cause you to have chest pain. And then mostly that chest pain is like when you cough, you feel the chest pain, or when you take in deep breath. We call that like pleuritis, or something same, pleuritic pain. So pneumonia can basically also cause chest pain as well. So if you're having pneumonia and you're having that, definitely, you want to get treatment for the pneumonia. And if the pneumonia is gone away, it's resolved, and you're still having chest pain, obviously, that needs to be taken care of, or that needs to be worked up further. Another thing is that most people would even have outside of like young people, will be something called costochondritis, just like rib pain. So if you have constant chest pain that is there when you kind of push around, like your chest pain, you're feeling this chest pain, but you push around and it hurts. That is mostly like the rib that hurts. So it's mostly like musculoskeletal. So costochondritis basically is what you call it. And mostly supportive care, the Tylenol, the ibuprofen, all of those should help as well. The reason we are so serious about chest pain, as you can tell, is because we don't want to miss a big thing. We don't want to miss a heart attack. We don't want to miss a pulmonary embolism. Like, or chest pain. I didn't tell you, because when feel chest pain, I just say, we don't want to say, because you say you miss it. So when you heart attack, so when you clot to be a call with lungs, and I say BB a rupture, BB a dissection. We don't want to mix those big things, because those are deadly things. Some of these things can also be, dangerous and can be fatal when you sit around for a long time. But these are the reasons why we are so serious, or we are always emphasizing, go see if you're having chest pain. Obviously, this is something that you need to be worked up for. Not everything is an emergency, but definitely if you're having chest pain, you need to go see a doctor, and it needs to be figured out whether this is cardiac, whether it's from, cardiac in terms of coma, pulmonary, your lungs, even GI, can even be as a result, can even cause chest pain. Plus, I talk about GI. So ulcer, some people have chest pain because they have severe ulcer, and peptic ulcer is one of those things that, you feel like you're wakuma, sometimes, because mostly after we've worked up all the serious things like the heart attack and things that we haven't found a reason, the next big thing is mostly like GI. So like an ulcer, like a pancreatitis, even gallbladder. Gallbladder can sometimes feel like a chest pain, because you can have that right-sided pain ready. It can go to your shoulder, mostly like your right shoulder, and go to your back with pancreatitis as well. So it feels similar to some of these like cardiac symptoms or cardiac chest pain, cardiac cause of chest pain that we are talking about. So that's another GI cause. Let me see, is there anything else? Oh, anxiety. People that have anxiety could also have this like chest pain, but again, that only happens when you have anxiety, and they're being workup to rule out all other causes of chest pain. So it's probably anxiety, but I wouldn't always chalk your chest pain to anxiety. If you're having chest pain not at the time of your anxiety or panic attack, that needs to be taken care of, or that needs to be worked up. Another thing is shingles. I wouldn't say chest pain, but you have like, when you have the shingles, the lesions, you have mostly it's unilateral into baby rational eguno. And when I would feel pain, and most people have it on like their chest or their torso, their trunk. So that area could have significant like tingling pain. And even after the lesion is gone, some people have significant pain. So they may be like, okay, I'm having it whilst I have the shingles, but after it's gone, you know, the lesion is gone, you got treated for, you're still having this like pain that is still there. It's more of a neuropathic pain, not because it's from your heart or other things that we've talked about. And mostly treating it with, you know, gabapentin or something like that. But it's more of a neuropathic pain and neurological type of pain as compared to the other things. And the last one, which, you know, is the evil of all evil, obviously, is malignancy, cancer. Listen, you can get cancer basically anywhere, you know, chest wall, your breast, even breast pain with just menstruation. It feels like you're having pain in that area, right? If you're breastfeeding, you know, inflammation of your breast or some form of breast infection. But cancer can do basically anything. But again, we don't want to chalk it up to, you know, cancer when you have chest pain and you have cancer. All the things that I've talked about, mostly the big things, the cardiac and the pulmonary things, will be ruled out before we say, okay, this is just, you know, coming as a result of that. Sometimes if you have like a big pancreatic mass, obviously you're going to feel some form of pain and radiating pain, not necessarily the pain there causing that, but you know, the pain is being like referred to other areas because of the neurons in that area, basically. And see, yeah, can be brave, but mostly the big thing is that ufili say unya owo chest pain and I say wakuma baby ayo ya middle, left, right. If you like BB is wakuma, so you feel heaviness, you know, was sweaty or fifretail. Yeah, Juma, also what's say kakra, na say import na about 2 minutes and 3 minutes, 5 minutes. Na call, homete, or blood pressure was through. All of these things are urgent, even an emergency that you need to go and see the emergency room or go see your doctor about it. Okay, I hope this was very helpful. Just to be able to recognize things as we move on. Please let me know if you have any questions. Let me know if you'd like me to dive further into one particular one. We may talk a little bit more about the cardiac cause of chest pain in the future, but this is more, there are so many causes of chest pain. But if you have chest pain for any reason, go see your doctor. And make sure that you have gotten thorough workup to be able to find the cause of your chest pain. And thank you guys again for being here. I will see you next time. Bye.